good afternoon. This is your favorite son of the Queen City of Buffalo, Stan the Man Martin. Happy to be here today, and looking forward to our conversation. I'm one of your co-hosts of Reach Talk, where we talk about all the things that's happening in terms of health and what's relevant in our communities, especially those communities that are underserved, and in some cases they even have been left behind. So I'd like to bring that perspective in terms of what's happening here in Buffalo, New York, and also to share information with you that's what's also happening abroad across the country as well. I have the pleasure and privilege of being with my co-host, who needs no introduction, Sam, as we call her. Why don't you introduce yourself and say a few words for our listeners, folks who might be joining us, who might not be familiar with you and your work.
I thought you said I needed no introduction.
Yeah.
I'm just kidding. I'm Samantha nephew, Sam. I work as a healthcare advocate with one of Reach's great community partners, Healthcare Education Project, which is part of 1199 SEIU. And I've been part of Stan's tag team, the Reach team. We're practically family, and I enjoy getting the good word out there about public health and health safety, and addressing, the inequities in healthcare. A pleasure.
Exactly. Now you see why we work together, right? Yes.
Mm-hmm.
Thank you so much. How's everything going in the world of Samantha? Sam, how are things going?
Things are going okay with me. I'm concerned about this whole climate change thing, considering we've all been dying of heat this last week. A little bit more so than usual, it feels like. So.
Yeah, it's busy. It's definitely busy. So likewise here, hot and humid, and even though we're in this virtual space, it's certainly it still is another dull moment, as I like to say.
Oh yeah.
Thank you. So for those who might just now be joining us for the first time, thank you for being here in the space. Just want to just quickly remind folks that Reach, actually is the acronym, here in Buffalo. It actually stands for Racial and Ethnic Approaches Towards Community Health. We, along with the Buffalo Center Health Equity and the African American Health Equity Task Force, has been able to partner with organizations and individuals such as Samantha, to really look at how can we change the trajectory of health outcomes, here in Black and Brown communities of the city of Buffalo. And we're in our third year in terms of implementation of some really best practices and some promising and innovation strategies, I would like to say as well, to change the health outcomes in our area. So, that being said, typically we, bring to you our local perspective, but we have the pleasure and the privilege and the honor of bringing and inviting someone to the show with us, Dr. Yabo. I'm going to share with you some information who's joining us today. And, I must say, full disclosure, I asked Dr. Yabo at the last moment if she can join us to be a part of our Reach Talk. And, I was really, if you can remember a moment in time, for those of you might have been trying to ask that person out for that first date, oh man, will he say yes or will she say yes? So when they go to the prom and you got those nervous butterflies, and, flustering inside of you. Well, that's how I was when I reached out to Dr. Yabo at the last moment. And so when she said yes, I was just totally excited and overwhelmed. But that's my full disclosure. So just a little bit of information I want to share. She's a pediatrician with over 20 years of experience in private practice and urgent care settings. She is also a public health professional with several years of work experience at the CDC, and in particular in the Immunization Services Division, where she led as a medical officer and subject matter expert on immunizations. She's assisted in the development of and presented educational content for live print, web-based, and remote audiences at the local, state, and national levels. Listen, this woman is bad, y'all. I'm telling you, okay? And she currently serves as I mentioned, the immunization subject matter for the CDC, and in particular of working in the area of AIM. And she's going to talk more about that. So we're just so happy, to have her join us today. So without further ado, Dr. Yabo, thank you for joining us this morning. Welcome to Reach. Give you a round of applause.
Oh, thank you so much. I'm truly humble and just want to say thank you, Stan and Sam, and to all your partners for this opportunity. So thank you.
Thank you, thank you, thank you. So, before we get into the, the nitty gritty, and talking about, vaccination and what's happening in our world surrounding COVID, that is one of the main focus areas of REACH, increasing vaccine uptick and building awareness and education surrounding the importance of not just COVID vaccination, but also flu as well. Can you just talk a little bit and share with us, please? How did you get into this field? What interests you? What motivated you to get into this line of work?
Right. As you already shared, Stan, I worked for several years as a pediatrician and then went into the public health arena as a medical officer at the CDC. And I did that for several years. I returned to private practice after leaving the CDC. And then a few months prior to the pandemic, realized that I was being called to do something else and left that up to God. What is it, God, that you want me to do? Well, pandemic hits 3 months later, and the new word, right, for 2020, I had to pivot and
Right.
basically come into position. And I was lucky enough to be accepted to serve as the subject matter expert for the AIM Reach project, which Stan has mentioned. It's a national project where a grant has been provided by the CDC to fund different organizations across the country to ensure that immunization rates for flu, COVID-19, that we are in the position to help communities increase vaccine acceptance and immunization rates in their communities. So that is really close to my heart because this is my community. All of these communities are my communities. That's what we do day to day. And so I'm just so happy to be able to do this work.
Yes, yes. No, thank you, Dr. Yabo. You and your team are doing some great work. And if I'm not mistaken, I think I know under the Reach grant, there's like I think 30 to 31, grantees across the country. So, you're working on you're seeing things from a large perspective, across the globe here in particular. I'm just
That's
wondering. Yeah, I was just wondering if you can perhaps share with us, um, what are your thoughts just in terms of how the social determinants of health, how they impact, Black and brown communities, or communities that has been hardest hit by COVID.
And Stan, you're absolutely right, because we are able to see it from east to west coasts, the north and south of the United States, what's happening around the country. And unfortunately, we all know we're at a position now where there have been over 5 million cases of COVID in this country. Over 160,000 people have died. And unfortunately, us as Black and brown communities are bearing an increased number of those cases and deaths. And why is that? You hear people talk about these social determinants of health. These are things such as poverty, differences in income, types of jobs as essential workers, lack of education, community conditions, lack of access to quality healthcare, racism, discrimination. All of these can limit someone's access to resources for improved health. And so these are all the conditions that we find ourselves in. These are not new, they've been longstanding, but that have contributed to these disparities in the number of cases and deaths in the Black and brown communities due to COVID-19.
Wow. And no, thank you. Those are some powerful stats and information. Like when I remember when COVID first hit our community, or in its early stages, or when it first came out back in like almost 18 months ago, or what have you, or more. Here in Buffalo at one point in time, you know, um, you know, communities of color, or people, Black and brown individuals in particular, was twice as likely to get it, and three times more likely to die from it. And
Yep.
that's alarming. So when you think about essential workers and who's greatly impacted by it, I was just wondering, if you've seen anything nationally, or heard anything on a broader scale about those with underlying health conditions, pregnant women, and young folks who are unvaccinated. Is there anything you wanted to uplift, in those areas?
Definitely. And just to piggyback on what you just said, Stan, there's been a recent report it's called The State of Black America. It's a report by the National Urban League, and they're partnered with Johns Hopkins Center for Health Equity. And just as you said, across the nation, Black and Hispanic communities have an infection rate of 3 times that of whites, even still so at this point in the pandemic. And some of the factors that you listed, because we live in multi-generational households, there are more people in our households. We work in essential jobs. We cannot work from home. And so we're out there, we're in the community working, so our infection rates are higher. Unfortunately, some of us also have more of these chronic health conditions you mentioned. For example, high blood pressure, diabetes, obesity, all of these things by themselves, if they're stable, you're fine. But if all of a sudden you catch flu or COVID with asthma or diabetes, that makes your underlying condition, your asthma or diabetes, unstable. That could cause you to have severe complications. You could end up in a hospital, in the ICU, et cetera, because now you have COVID plus a worsening of your underlying health condition. So that is why persons who have those underlying conditions are at such higher risk.
Wow. Yeah, I'm always amazed, because I've been in this field for almost 20 years, I think. At some point you stop counting.
Right.
But one of the things about Buffalo, Dr. Yabo, you may or may not be aware of that. At one point in time, we're like in the top 5, of the most segregated cities. The top 5 in terms of the poorest cities, here in America. So, these things locally, people are like, why is this important here? Because we're talking about when you put a face to those numbers, to those impacted by it, it matters.
Yes.
It's definitely reflective. I'm just wondering, also if you could share a little bit about, with all of this information, we know information alone don't change behavior. Why are, in your opinion, why is people still so hesitant? Is there, things that you've heard that you want to share, and also any myths that you want to dispel as well, in regards to that?
Sure. This whole issue of vaccine hesitancy, those of us who work in public health, unfortunately, is not new to COVID-19 vaccines. It's been around for a long time with other vaccines. It's just coming to the forefront. But one thing we have to understand is that it changes. People's thoughts and opinions can change about vaccines or a particular vaccine. And we're seeing now with COVID, in the beginning of the pandemic, we saw there were a lot more African Americans and persons of Hispanic descent who were more likely to say, oh, I don't want to get vaccinated. Now that has actually changed. So on a national level, we're seeing that the people who are less likely to want to get vaccinated are perhaps younger, white, Republicans, et cetera, those demographics. But getting back to your question, for our Black and Brown communities, why are there still a few people, we like to say, who have concerns versus vaccine hesitant? What concerns do they have? There's still issues of mistrust to deal with. Years and years of atrocities, from the Tuskegee experiment to current day mistreatment when you seek care as a Black or Brown person in the healthcare setting. All of that plays into your feelings of mistrust. And is the vaccine safe? Will there be long-term side effects? So those are all some of the reasons when we talk about concerns about vaccine that exist in our communities.
Right. Excellent. And I'm glad you mentioned about the concerns surrounding the Tuskegee, what has been done. And one of the things I was really glad to hear and see that the families of the survivors of those from the Tuskegee experiment came out and actually became messengers and spokespersons encouraging people to get vaccinated, because there was myths out there about injecting the folks or the people with syphilis, and that's not true. The fact that the penicillin that was withheld from the treatment
Exactly.
of the syphilis. So a lot of people aren't aware of that, and it was really just great to hear them come out and encourage people to get vaccinated. And now, here it is. We have a cure. We have a vaccine that can treat, or at least help manage and deal with COVID as well as the flu. So the more we can build the confidence, that'd be great. So I want to turn it over to my friend and colleague, Sam. I know this is not the Stan the Man show, so this is the Samantha show as well. So Samantha, any thoughts or questions you might have for our esteemed guests?
To start, I would actually just like to go ahead and uplift the indigenous communities that have also been part of this. I am part of the Seneca Nation here in Western New York myself, and so I've been keeping an eye on, what's been happening mostly within reservations. I can speak to my experience as one that grew up in the city, but especially on reservations across the country, COVID has been ravaging these communities. People drive in and out, but then they're very much isolated in a lot of instances. And so they spread really quickly. And when we talk about the social determinants of health, I truly believe that culture and belief is absolutely one of the social determinants, right? Yes. And so a lot of what happened in these communities, because the most vulnerable was the oldest, we saw in a lot of tribal communities a decimation of people who spoke the language. As with any community like that, it tended to be older folks. And so there were cases that I read over and over again where they dramatically decreased the number of native speakers. And with that, a lot of, the traditions and things of that nature that maybe haven't gotten passed down yet. So I just wanted to uplift the fact that that was the thing in this country, where we have very isolated communities who may not have easy access to healthcare to begin with. So when we're talking about needing ventilators and things of that nature, that people had to travel long distances. And so this virus definitely, obviously, on public health, but also in the cultures and traditions that were still here somewhat relatively, but now we're facing a crisis in that area as well.
Yeah, and if I could address that too, Sam, for a minute. Nationally, across the country, we have pockets of American Indian or Alaskan Native populations around the countries, and we are seeing that phenomenon as well. They're 2 times as likely to get infected, 3 times as likely to be hospitalized, and twice as likely to die as compared to the white counterpart. So this is all over the country. You outlined some of very similar social determinants of health. And one thing that you mentioned that ties into what Stan mentioned is getting rid of trusted messengers through illness or death in communities and how important that is. I know Stan talked a lot about vaccine acceptance and how we can increase that. It's so important on a community level to realize that when we're trying to educate our communities about the facts, dispel some of the myths about COVID-19, that trusted messengers are needed. It may not be who you think. It may not always be the celebrities, etc. We're talking about your trusted doctor or pharmacist in your community. It could be your trusted hair care stylist. It could be your trusted religious leader in your community. In the case of community you mentioned, Sam, it may be the elders in the communities. So I know there were some communities who tried to make sure that their elders were vaccinated first to ensure that they will continue the traditions and the beliefs and cultures. But that didn't always happen, as expected. So it's so important on a community level that we make sure that we're working on acknowledging trust within our communities, developing the right trusted messengers, and sending the right messages after we hear from our communities. What are your concerns? Then developing the messages.
I 100% agree with that. So with that, I'm going to go into one of our other questions. And this one is in regards to the Delta variant.
Sure.
How has the virus spread throughout these communities, and why is it spreading so quickly?
Unfortunately, the virus by itself, the classic variant, meaning the one that started back in December of 2019, was spreading anyway, especially in areas where people are not vaccinating, if you're not wearing masks or social distancing. Then comes along this Delta variant. Viruses change. Whenever they think we as humans have a grip on them and we're trying to control them, they're going to morph or change or mutate, and they develop strains. One of them is this Delta strain. And unfortunately, it's twice as contagious as the original variant. And you can spread it more likely if you're not vaccinated to other people, and you become sicker from it if you're not vaccinated. So it's spreading in communities where we have lower vaccination coverages. And unfortunately, that's still a lot in our Black, Brown, American Indian populations where our vaccination rates are lower. So the Delta variant may spread faster. And if you're not vaccinated, you catch the Delta variant, you're more likely to be hospitalized or die than someone who is vaccinated. So that is, those are some of the facts about the Delta variant.
Oh, I appreciate that. Thank you. So we actually prepared another question here, set of questions, but you kind of answered them already. But if you had anything else that you wanted to say about how can we build vaccine confidence, what are some of your, if you have more recommendations for our listeners, and who are the trusted messengers? You kind of answered that, but if you wanted anything more to say.
Sure. I'll start with, again, on a community level. For the trusted messengers, we outlined some of who those were, but making sure that every time you work in a community, and Stan always talks about this, making sure you continue to engage with the community. This is not just about COVID and flu. Remember, we talk about these social determinants of health. They've been around for a long time. We have to address those as well, because when we come out of this pandemic, we want our communities to remain strong and to remain healthy. So I know, again, Stan and his team are great proponents of this. You want to stay involved in your communities. You want to invest in your communities, invest your time, your attention, your funding in the communities. And you want to really make the community a part of educating itself. It's not just as a partner coming in and talking to the community, making sure the community is involved in that education. And then what about on the individual level? And I'm saying this as a mom, as a cousin, as an auntie, etc., because we're all having these conversations day to day with our family and friends. Be empathetic, listen with empathy to your family members. Ask them open-ended questions if they have concerns about vaccines. And then share trusted information from reputable sites. Don't forward any misinformation or rumors, things that you get on social media posting. And explore the reasons that for wanting to get vaccinated. What's going to tip you over? Maybe it's because you want to attend an important family event coming over, or family trip that's coming up. Maybe that could propel you. But again, just be non-judgmental and listen with empathy.
I love that. Sometimes your trusted messengers are your sisters, your brothers.
Yes.
My younger sister got vaccinated. She had no plans on doing it, but I told her I'm just not comfortable with coming to see you until we're both. And so after I said that to her 2 days later, she got her first shot. Okay. So, it does work.
It does.
So then now we just want to ask you, we have a couple minutes left here, but do you believe our booster shot's going to be necessary?
Well, it's funny you say that. So yesterday, the FDA authorized a third dose of booster doses of Pfizer or Moderna for a few people who are severely immunocompromised, meaning their immune systems really do not work as well. So not for everyone, but just for a few people. So as of now, booster shots are not recommended for everyone. That may come later, but just for certain people who have very severe immune systems. And also, we just wanted to make sure, I know we have a few minutes, ask about boosters, that we encourage pregnant women to get vaccinated. We are seeing that pregnant women, their vaccination rates are very low, less than 20% in some areas of those who are eligible. And new studies have come out, new information has come out that makes both the CDC and ACOG, which is the Organization of Obstetricians and Gynecologists, very comfortable in making a full recommendation that pregnant women should get vaccinated prior to pregnancy or during pregnancy. There are studies, there are data that have come out now that show that these vaccines are safe in pregnancy. They are not going to increase miscarriage rates. They're not going to have harm to the pregnant woman or to her baby. And we need to send this message across because pregnant women are very, very at high risk for complications from COVID. They could end up in a hospital, ICU, on a ventilator, etc. So definitely wanted to send that message out.
Oh, great. I appreciate that. we still have about 5 minutes. So I would actually like to ask a question that's not on our list here. I hope Stan doesn't mind. But could you speak to under 18-year-olds getting, the ones that are okay with okay to be vaccinated? What would you tell a parent who is not sure whether or not they should give consent yet?
Exactly. So right now, there's one vaccine, the Pfizer vaccine, which is authorized for persons 12 years and older. So that's the only vaccine that a teen or adolescent can get to protect them. Younger kids have not yet been authorized to get vaccine, but it's coming, it's on the way. So as a parent myself, I would counsel parents to realize that COVID disease is a real thing in kids as well. Kids are getting sick, especially with this Delta variant. They're getting sick in larger numbers, especially those who are returning to school. Here in Atlanta, we started 2 weeks ago. We're seeing increased number of kids going to the ER, the urgent care, and unfortunately being hospitalized. Kids have died from COVID. There have been over 400 deaths in children since the beginning of the pandemic. Compare that to every year, approximately 100 kids die from the flu. So in that period of time and a little bit more, 400 kids from COVID. So this is serious. Kids also can have what we call long haul, just like adults. There are kids now who had COVID disease and they still have brain fog. They have problems with memory. They're having heart problems from the COVID disease on a long-term basis. So these are real. So I encourage every parent who has a teen to go ahead and get them vaccinated to protect them against COVID-19.
Okay, appreciate that. So with that, is there anything you would like to share that maybe we haven't already discussed that our viewers should know?
Just briefly about the flu vaccine. You're going to be hearing more about that in the upcoming month or two. Flu this year, we are concerned that it may be more severe because we didn't have a lot of flu activity last year. Thank goodness, because we wore masks, we were social distancing, but flu may come back with a vengeance this year. We want to be prepared. We do not want to be in a situation where you have flu and COVID at the same time. So we recommend everyone, when the vaccine is available, get your flu shot. And also, if you have not already, get your COVID-19 vaccine.
All right, Stan?
All right. Thank you, Sam. And thank you, Dr. Yabo. I really appreciate, you sharing your wealth of knowledge and information. I think some of the key takeaways that, we want our audience, our listeners, to walk away with, certainly, to, wear a mask.
Yes.
Some things that you can do right away. Wear a mask. You can wash your hands and
Yes.
Practice social distancing. And also, have those conversations. I love that you mentioned, with your family members, with your friends. You are essentially, most valuable, in driving this virus out,
Yes.
of our communities. I want to say, and are a trusted messenger. So within your networks, within your social squares, even this virtual world, I'm gonna say, you have power and you have influence. And I love the fact that you lifted about social media. I had the pleasure of working with you and your team on, educating people, the community on, how social media can be a detriment or can create more confusion and chaos, with misinformation.
Yes.
So encouraging people to do their research, do your homework, and last but not least, or maybe foremost, to get vaccinated.
Yes.
You're doing it for yourself, doing it for your family, and also do it for your friends and community. Because we want to have those, we want to, get to holiday seasons coming.
Exactly.
So we have those traditional ceremonies, that we have that we want to see our loved ones and those that we care about. So thank you for your knowledge and information. Just a few things before we wrap up. Just want to highlight that Samantha, maybe you might want to do. We have an upcoming event, that Reach is looking to sponsor with Urban Family Practice.
You got it. Yeah, no. Reach is a co-sponsor of the upcoming Urban Family Practice Health and Wellness Fair. It's on August 28th. It's the same day as the Puerto Rican Day Parade. that'll be happening here. It's going to be at the end. It's from 11 a.m. to 6 p.m. at 564 Niagara Street. The COVID vaccinations will be available as well as the flu vaccination. So that's important. One plug real quick. Also, Jennifer McCosey Healthcare Education Project. I'm sure Reach will be a part of it as well. We're giving away backpacks as well as health information on September 4th. So that's Labor Day weekend. Come get a backpack before school starts.
All right. Thank you, Sam. And we got to give a shout out to our other friend and colleague, Ebony White. Dr. Yabo was saying earlier about, the importance of community outreach, education, and listening. And, Ebony White, for those who know Ebony, you know what I'm talking about. For those who don't, listen, she's the champion of community outreach and education and engagement and mobilization and et cetera, et cetera, et cetera. So she couldn't be with us today because she's doing exactly that right now for the Ignite Hope event that's happening, and looking at historical trauma and how really exploring how we can change the trajectory, of health outcomes, for our communities, that have been underserved. So, we're looking forward to providing you all with an update on that event as well, in the weeks to come. So, once again, thank you, Sam. Thank you, Dr. Yabo. Appreciate all that you are doing, you and your team. And for further information, folks, please feel free to follow us on social media as a credible source at Reach Buffalo. And without further ado, you all enjoy the rest of your day. Take care, everyone.
Great. Thank you, everyone. Thank you. Thanks, Stan and Sam.
Thank you as well.
Okay.
Reach Buffalo, promoting a healthy community. Reach racial and ethnic approaches to community health locally in Buffalo to reduce racial and ethnic health disparities and rates of chronic disease. We want to make a change by reducing exposure to tobacco in housing and work areas, by increasing access to nutritious foods, by creating a breastfeeding community, by increasing referrals to primary care and community health providers, and by implementing community work groups. Reach Buffalo will concentrate on Ferry Street itself, as well as a community that resides within 4 blocks to the north and south of the corridor in 5 zip code areas: 14208, 14209, 14211, 14213, and 14215 in Buffalo, New York, with disparities in rates of chronic disease. Get involved. Ferry area residents will have an opportunity to have a platform to voice their opinions, organize, and make decisions in these efforts. For more information, you can contact Ebony M. White, Community Outreach Coordinator, at 716-268-2954.